Now, for the next concept which we'll be looking at what ototoxicity. Now, when you're talking about anything auto, you're actually referring to the air. Auto is another name for the air. Toxicity, everybody knows, okay? Toxicity is something that is not friendly. So if you are saying ototoxicity, there's an air poisoning. You get. So before focusing on the definition, then mostly you guys should take note of the causes, okay? Like symptoms, diagnosis, management, and all of that. Okay. So we still talk about the possible causes again here. All right. It's focusing mainly on the causes. Okay. For definition, we say that ototoxicity refers to what? Commonly as air poisoning. It can be caused by exposure to some certain drugs or chemicals that will actually damage the inner ear. Okay. So it can lead to hearing loss. You can lose your ability to hear. It can lead to tinnitus, which is what ringing in the ear, ding, like that. And you can have some balancing problems too. Okay. So what are the causes? Causes could be divided into the following. So for medication, common ototoxic medications include what? Aminoglycoside antibiotics. Like what? Gentamicin, streptomycin, loop diuretics. Okay. And some certain chemotherapeutic drugs like what? Cisplatin, carboplatin. Okay. Chemicals, you could be due to some exposure to some environmental chemicals like what? Mercury, lead, toluene. All of this can actually cause what? Ototoxicity. There's some over-the-counter drugs like aspirin or quinine. All of this can also cause what? Ototoxicity. Okay. Then symptoms, like we mentioned, there's hearing loss, there's tinnitus, there's issues balancing. There's some other associated symptoms, can be having lightheadedness. Okay. Can be feeling tired, can be having troubles walking in the dark. Okay. Diagnosis is hearing test. Okay. We're using an audiometry to access hearing loss. Balancing test, you're trying to evaluate balance and vestibular function. Medical history, you review the medications and exposure to potential ototoxic substances. Management is discontinue the medication. If it's a medication that is causing that thing, discontinue it. Then keep monitoring the patient. There's some therapies like what? Hearing aids, cochlear implants, vestibular rehabilitation. You can use all of this for managing the symptoms. Okay. Prevention is using the lowest effective dose of any ototoxic medication. You don't do any drug abuse. Okay. Therefore, environmental safety, reduce exposure to what? Chemicals, and ensure safety measures in occupational settings. Okay. So that's it for what they mean by what? Ototoxicity, commonly known as what? Air poisoning.